This oral suspension is used to treat seizures caused by a specific inherited disease known as cyclin-dependent kinase-like 5 deficiency disorder, CDD. The exact mechanism of how ganaxolone works is not fully understood, but it is believed to affect the action of certain nerves that are responsible for causing seizures. It is important to follow the recommended dosage and take it at the same time each day for the best results. When starting ganaxolone, it's important to read the medication guide and instructions for use provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with food as directed by your doctor, usually 3 times daily. Before use, shake the bottle well for 1 minute. Then let it stand until the foam on top of the suspension is gone, about 1 minute. Carefully measure the dose using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. The dosage is based on your medical condition, weight, and response to treatment. Your doctor may direct you to start this medication at a low dose and gradually increase your dose to reduce the risk of side effects. Use this medication regularly at the same times each day to get the most benefit from it. Do not stop taking this medication without consulting your doctor, as some conditions may become worse when this drug is suddenly stopped. Your dose may need to be gradually decreased. Tell your doctor if your condition does not improve or if it gets worse. Some common side effects of Ztalmy 50 mg per milliliter oral suspension may include drowsiness, tiredness, or fever. If any of these effects persist or worsen, it is important to consult your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefit to you outweighs the risk of potential side effects. Many people who use this medication do not experience serious side effects. A small number of people who take anticonvulsants for various conditions may experience depression, suicidal thoughts/attempts, or other mental/mood problems. It's important to notify your doctor immediately if you or your family/caregiver notice any sudden or unusual changes in mood, thoughts, or behavior, such as signs of depression or thoughts about harming yourself. While a very serious allergic reaction to this drug is rare, it's crucial to seek medical help right away if you experience symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects that are not listed, it's essential to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report side effects to FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects, or report side effects to Health Canada at 1-866-234-2345. Before starting ganaxolone, make sure to inform your doctor or pharmacist if you have any allergies, as this product may contain inactive ingredients that can cause allergic reactions or other issues. It's also important to discuss your medical history, especially if you have liver problems, mental/mood disorders, or a substance use disorder. It's important to note that this medication may cause drowsiness, and using alcohol or marijuana can enhance this effect. Therefore, it's best to avoid driving or operating machinery until you know how the medication affects you. If you use marijuana, it's important to discuss this with your doctor. Before undergoing any surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to use this medication only when necessary. Untreated seizures can be harmful during pregnancy, so it's crucial not to stop taking the medication unless directed by your doctor. If you are planning to become pregnant or if you think you may already be pregnant, discuss the benefits and risks of using this medication with your doctor. It's also important to consult your doctor before breastfeeding, as this medication can pass into breast milk. It's important to be aware of potential drug interactions that can affect how your medications work or increase the risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. Before making any changes to your medication dosage, always consult with your doctor first. If you are using other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines, it's important to inform your doctor or pharmacist. Be sure to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. If you have any concerns, don't hesitate to ask your pharmacist about using those products safely. If someone has taken too much Ztalmy 50 mg per milliliter oral suspension and experiences severe symptoms like passing out or difficulty breathing, it is crucial to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center for assistance. It's important to act quickly in these situations to ensure the individual receives the necessary medical care. Sharing Ztalmy 50 mg per milliliter oral suspension with others is not allowed by law. If you forget to take a dose, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one. Take the next dose at the usual time. Don't take double the dose to make up for the missed one. It is important to store the bottle of Ztalmy 50 mg per milliliter oral suspension antidepressant neuroactive steroid Gaba-A receptor modulator upright at room temperature, away from light and moisture. After opening the bottle, it should be discarded after 30 days. It is also important to not store this medication in the bathroom and to keep it away from children and pets. When it comes to discarding the medication, it should not be flushed down the toilet or poured into a drain unless specifically instructed to do so. Instead, it should be properly discarded when expired or no longer needed. If you have any questions about how to dispose of the medication, it is best to consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.